Finding accurate information about what you should eat and drink nowadays can be difficult, especially if you have a medical condition. There's lots of information available on the internet, social media, and on TV, but not all of it is right, good, or true, and not all of it is safe. So where can you go for safe, personalised advice based on the best and most up-to-date evidence? That's what dietitians do. Dietitians are regulated nutrition healthcare professionals trained to translate the complex science of nutrition into easy-to-understand advice that is tailored to you. Dietitians are the only nutrition professionals regulated by law, accountable to the Health and Care Professions Council, and required to maintain their professional competence. This means the advice you will be given will be safe, within your best interest, evidence-based, and honest. Every dietitian completes years of study, as well as clinical experience working in a range of settings to prepare to support you. So how does a dietitian make sure their advice is tailored to you? Dietitians think about so much more than just what you eat and drink. They consider all the factors that influence your diet, your relationship with food, and your wider health and well-being. Dietitians consider your age, gender, physiology, and mental health. They know one size does not fit all. If you have a medical condition, they have the skills to know how your diet will interact with your medications or treatment, and what impact diet may have on your symptoms. They look at culture, taste, and cooking skills, so they don't just recommend food that is good for you, but that you'll want to eat. They take into account your environment, social situation, and lifestyle, and your activity levels to provide holistic solutions that take account of the full picture. Dietitians are trained communicators and learn behaviour change techniques to help motivate you to improve your relationship with food. Their training means they can combine all this information with the latest scientific evidence and their own experience and expertise to create advice and treatments that work for you. You might encounter dietitians in lots of different places. They work in the NHS, in hospitals and GPs practices, as well as in the community and visiting patients in their homes. They also deliver public health services to the population at large. They also work in the private sector, helping clients to improve their diet or manage a health condition. And they work with industry and manufacturers to influence the food and drink we buy in the shops or eat in restaurants. Research dietitians ensure that we have the latest evidence on food and diet, and teach and train the next generation of dietitians, doctors, nurses, and other health professionals. They work with top sports stars to help them achieve their goals. And you'll see dietitians on TV and in the media too, helping sort the fact from the fiction and improving everyone's understanding of nutrition science. Dietitians do much more than you might realise.